Which procedure would provide the best results to remove the neck and jowl sagging? I know the jowls aren't bad yet, so I'm not sure what options I should consider. I'm 51 and am in excellent health and don't smoke. Many thanks.
Thank you for your question. You're 51 years old and you want to get a sense of what's the best option to deal with some sagging skin under the neck from the two photos you submitted, and otherwise you're in great health. So what I'll do is share with you my general approach when we meet patients like yourself in our practice. I'm a cosmetic oculofacial plastic surgeon. I specialize in facial aging procedures, such as all the different types of face lifting procedures, and in practice for over 20 years in Manhattan and Long Island. So when we look at someone like yourself, during a physical exam, I generally find that vertical lifting is usually the ideal solution to deal with this limited amount of skin under the neck. There have been, for someone like yourself, there's been a proliferation of thermal devices that attempt to replicate what's done with surgery, and those devices are not only disappointing, but they're actually causing a lot of damage. I'm seeing this in our office every week. We're seeing patients who got this new, latest, greatest heating device that's supposed to lift your skin without surgery. And what I'm finding is that instead of lifting, they're actually losing volume in their face in terms of the fat under the skin. Now that may sound in first impressions to be a good thing, but it's very important to understand that on the face or in the skin, in the body, anywhere, a certain layer of fat is very important to maintain a quality to the skin and the health of the skin. There is more and more evidence that the fat directly under the skin is more than just padding, that it has stem cells and it has so many beneficial and important communications with the skin that we, in other areas of our practice, we use that to our advantage when we use platelet-rich plasma and other things to actually enhance the fat. So I would discourage you to begin with from doing one of the thermal energy devices. I just think they don't work. But when we talk about different kinds of lift, there are a lot of options. In over 20 years, I have seen facelifts go from general anesthesia procedures with multiple drains and overnight hospital stays to quick recovery facelifts that only take an hour. And in between that range, there's a variety of options. Different ones named by anatomy and others named by incision style. Let's understand some basic principles before we just jump on what that procedure is. But just to also state is that when I examine a patient, I will have them look in a mirror and I'll lift their skin and see what would the end result be. Underneath the skin is an important muscle called the platysma. And sometimes, although it's not seen necessarily on your photos, there are things called platysmal bands. And what we do is when we are dealing with platysmal bands, we have to address them as part of the overall lifting procedure. So the impression I'm going to give you is based really on a limited amount of information with the photos, but also give you some conceptual ideas. So when it comes to lifting someone who's young, who's got a good bone structure as you do, and decent skin quality, usually some type of vertical lift is appropriate. And we want to do this with as small an incision as possible. This way you don't have the obvious sign of having a facelift, and at the same time you also have a less invasive overall experience in terms of the surgery. Let's understand some basic principles. In facial aging, there are two things that happen. We lose volume, and in other words, we lose bone, muscle, and fat, and everything goes inward, and then there's descent. There's descent of skin and descent of a very important structure on the face called the SMAS. The word SMAS is an acronym for Superficial Musculoaponeurotic System. This is the layer under the skin which transfers the activity of the muscle to the skin. It's a communications layer. And so this layer gets weak and thin as we get older and sags. So any procedure involves not just skin, but also some type of maneuver to address the SMAS. Now this can be anything from the range of plication to suspension sutures to flaps and a lot of different variations of all those. What's most important is that you do a procedure that is going to last and that you do something that isn't a shortcut. A very well publicized company that was doing a large-scale volume of facelifts recently closed their doors, and amongst most of my colleagues, or many of my colleagues I should say, we all anticipated this demise because they were promising something very aggressively that they were claiming they can do in a way that none of us could do, when we all know how to do surgery. But what they were doing was claiming they can get the effects of a 3-hour full face and neck lift in 1 hour under local anesthesia without sedation or monitoring. And so ultimately this company had to close the doors. Meet with cosmetic surgeons who do a lot of facelifts. Look at the examples of before and afters. Get a sense of aesthetics. This is a very important decision. There is, in my practice, my style is more about natural. I feel like everyone has a unique character to their face, and when I see them and they have these facial aging changes, I say to them that what we'll try to do is get you back to where you were about 5 to 10 years ago. In other words, restore the definition of the jawline, improve the angle of the neck, and basically look like yourself but a younger version of you. Now there are other colleagues who actually prefer a more exaggerated appearance. And I'm not saying that's bad. I think it's just a matter of the aesthetics of the patient and the doctor have to be in sync. So in our practice, when we do a procedure like this, it'll be something like a relatively short scar facelifting procedure, possibly with plication or suspension or flap. It depends a lot on what I see while I'm doing the surgery. And this is an art, and it's not something, not everybody needs a deep plane facelift. This is a commonly used phrase these days, and because a couple of doctors are claiming that they do only deep plane lifts. The reality is that any experienced cosmetic surgeon who does a lot of lifting can do all these procedures and customizes to the individual patient. So I'd just be wary of an all or none type of approach. One size definitely doesn't fit all. In our practice, when we do a surgery like this, it takes us about 2 hours to do. It's done under local anesthesia with light IV sedation. That means we avoid general anesthesia. The patients are able to recover very quickly. We generally don't use drains. And once it's done, it tends to hold very, very well. And we always say that it can last anywhere from 5 to 10 years, depending on a lot of factors which I can control and other factors I can't control. You have to take good care of yourself. You have to eat right, sleep properly, and avoid toxic exposures, I should say, such as excess sunlight or smoking or severe stress. These are all the things that age you and accelerate the aging process. And I will say in the 50s you have to make very good decisions every day so that you maintain that youthful appearance. So again, understanding that your procedure should be a relatively limited procedure. It doesn't have to be an extensive full face and neck lift, but you need a physical exam to make this decision, and you also have to feel comfortable with the doctor and the aesthetics and the style to understand and anticipate what you can expect. In addition, as I said, in my practice, we do this under local with sedation. I feel that there's a distinct advantage over general anesthesia in terms of patient experience and quicker recovery, and then take it from there. So I hope that was helpful. I wish you the best of luck, and thank you for your question.